Live now.
Okay. I'd like to welcome everyone to our electronic Board of Health meeting. Due to the COVID-19 pandemic, Regional Council is practicing physical distancing and councillors are participating electronically. I'd like to acknowledge that the land on which we gather today is the land traditionally used by the Haudenosaunee, Anishinaabe, and Neutral people. I also acknowledge the enduring presence and the deep traditional knowledge and philosophies of the Indigenous people with whom we share this land. I would now ask Leanne Wetzel if she would do roll call.
Chair Redmond.
Present.
Councillor Armstrong.
Here.
Councillor Clarke.
Present.
Councillor Erb.
Here.
Councillor Foxton.
Present.
Councillor Galloway. Councillor Galloway.
He's coming on. You're muted, Tom.
Here.
Thank you. Councillor Harris.
Present.
Councillor Jaworski.
Here.
Councillor Jowett.
Here.
Councillor Kiefer.
Here.
Councillor Lorentz.
Here.
Councillor McGarry.
Here.
Councillor Nowak.
Here.
Councillor Sean.
Here.
Councillor Strickland.
Here.
And Councillor Verbanovic.
Here.
All members present.
Thank you very much, colleagues. I will now consider a motion to reconvene an open session. This has been moved by Councillor Erb and seconded by Councillor Foxton. I would ask you to please use your voting buttons to vote to support that or vote against it.
That is carried.
Thank you very much. Do we have, as the Board of Health, we are now reconvened in open session. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? Seeing none, we have no registered delegations. Our first update will be a COVID-19 update from Dr. Wong. Welcome, Dr. Wong, and you have the floor.
Thank you, Chair Redmond. I'd like to ask Kathy Prosh to please bring up my slides for the update. Thank you, Kathy. So if we go to the first slide, please. So our COVID-19 rates continue to head in the right direction. As of February the 1st, our rate was 75 cases per 100,000 population per week, which is down from 142 per 100,000 population per week, a little less than 2 weeks ago. Next slide, please. We are also seeing that the number of workplace cases and outbreaks is starting to subside. Similarly, the number of hospital outbreaks is starting to ease. On the other hand, not unexpectedly, we are still dealing with a number of outbreaks in long-term care, retirement homes, and other congregate settings, although these are no longer growing at an increasing rate. The burden on the healthcare system is still quite heavy in terms of number of hospitalizations and ICU admissions and overall health system support to congregate care settings in outbreak situations. And sadly, I expect the number of deaths will likely continue to climb in the coming days and weeks. This is expected as these are lagging indicators and effects that occur in the weeks after a surge in case numbers. So overall, signs are that the shutdown measures have been effective. We are continuing in the right direction, but still many lagging impacts from the record number of cases and spread of COVID in Ontario and Waterloo region since late 2020 and especially early 2021. If we go to the next slide, please. So a question that has been on many people's minds is, when can our schools reopen for in-person learning? These are decisions that are made by Cabinet, who have indicated they are taking direction from Ontario's Chief Medical Officer of Health. Ontario's Chief Medical Officer of Health has sought the input of local medical officers of health on decisions such as this. And as you could see, I had to plan my slides before 4 p.m. and I understand the decision has already come down. I was going to say that I anticipated that the decision that will be made and that has been made will reflect the advice that has been given for Waterloo Region, and I see that it has. So our schools will return to in-class learning as of February the 8th. The province has also announced a plan for enhanced measures for schools returning to in-class learning, which include 1, mandatory masking for students in grades 1 to 3, including outdoors where physical distancing cannot be maintained. 2, enhanced access to targeted rapid testing, if needed, in situations of concern about ongoing spread. So examples of such situations could include multiple cases in multiple classrooms, an outbreak that affects the school at large, or a much higher number of cases at a particular school compared to other schools. I just wanted to note that this is not systematic, asymptomatic rapid testing in classrooms across Ontario. We are also working with testing partners to enable timely access to testing at the testing centers once school resumes. 3, process for validation of daily screening by secondary students and staff. And 4, new guidance discouraging students from congregating before and after school. Finally, as we receive more specifics from the province, local public health and partners such as our local testing partners who oversee testing will be working together with our local boards to implement these new measures. Next slide, please. So I just wanted to mention that in regards to the shutdown measures that we are currently under, I do not have more information to share at this time, except to say that the school reopenings are not tied to the lifting of broader shutdown measures. And if we go to the last slide now, in closing, trends are heading in the right direction, but we cannot let up on our precautions. We've seen in other jurisdictions that if we up too quickly, we can rebound quickly as well. The stay-at-home order is still in effect, and we need to continue to minimize our mobility contacts. And that was all from my update. I'd be happy to take any questions. Thank you.
Thank you very much. And thank you, Kathy, for being the invisible hand making the slides move forward. Councillor Clarke, go ahead. You have the floor.
Chair, I have a couple of questions, and one is related to COVID, but the other is related to the surge in overdoses that we're seeing, and the death that we seen earlier this week. But with regard to COVID, one of the things that's happening across the homelessness sector generally is advocacy around prioritizing people in shelters and who are part of the homeless population for vaccinations. So I do have a question. I'd like a comment from you about that, but also I attended a meeting yesterday. Dr. Chris Steingart was part of the meeting, and he said something that I thought was very interesting. He said that of the 45 positive cases that we've had in that system, which includes staff as well as people receiving services, all of the cases so far have been either asymptomatic or very mild symptoms. And that's interesting to me because the argument behind the advocacy that I'm certainly seeing is the assumption that people who are homeless are going to experience worse symptoms rather than lighter ones. And I'm wondering really if you have any insights around that, or any comments, and what our public health unit's position is around prioritizing this population for vaccines.
Thanks for the question, Councillor Clarke. So I can say that the prioritization of groups has been done by the province and will continue to be done by the province. So locally, we are to implement the provincial decisions in regards to prioritization. So congregate living settings that are not seniors living seniors living settings are prioritized for phase 2. So that's where they are right now. Now, in regards to the impact of COVID and the potential effect of vaccines, so what the vaccines have been shown to be effective at is reducing serious illness and death. To date, they have not been shown to reduce asymptomatic infection, and they have not been shown to reduce transmission. It may be the case that they will be able to do these things, or they'll have an effect on these things, but that's not what we know at this time. What we know at this time is that they are effective at reducing severe illness and death. And so what that is also a fundamental reason why the prioritization of the vaccine has been directed towards seniors living in congregate settings, starting with the highest risk congregate settings, such as the long-term care settings and the high-risk retirement homes, because that's where we've seen the most impact in terms of serious illness and death. And what we have experienced in the shelter population is that oftentimes the illness is not severe. It doesn't mean there couldn't be a severe case, right? We do know that COVID-19 can be more severe in those who have underlying health conditions, for instance. But it hasn't been the same level of mortality, for example, as we've seen in the long-term care homes. And so they are prioritized compared to the general population, but they are prioritized in phase 2 as opposed to phase 1, where we're targeting the long-term care homes, for example. I also would like to say that, there's been a tremendous amount of work that's been done by the partners who support those in shelters. And because of their excellent, work and efforts in trying to minimize spread in these settings, and as a result of enhanced, significant increased actually testing that's occurring right now in these settings, we are finding cases as we would find in the general population. But the amount of spread per se has been low. And that's been really a testament to the work of the partners, both the infection prevention and control measures that they have in place at these settings where services provided to those members of our community who access those services, as well as the support they provide to those who test positive and need to be isolated.
Sorry, did you have a specific question about the opioid overdoses as well, in addition to that?
Look, I'm not sure how specific the question is, but I was hoping for a comment. I know that there's been an information sent out to sort of warn people to be careful, but I'm wondering whether there's anything more that the integrated drug strategy is able to do at this time.
Yeah, at this time, I don't really have any updates on behalf of the integrated drug strategy, but obviously, we are continuing to work with partners on what more could be done. We are seeing these overdoses rise in our region, they're rising elsewhere in Ontario, and we know it's a serious issue.
Thank you.
Clarke, do you have any other questions?
No, that's fine. Thank you.
Thank you. Councillor Kiefer, go ahead.
Thank you, Madam Chair. Through you to Dr. Wong. Dr. Wong, I don't know if I missed it in the information that you sent along. It had to do with the kids going back to school and wearing masks, and I didn't see that kindergarten or pre-kindergarten kids were included in terms of wearing masks. So are they excluded from wearing masks if they don't want to? Or
yeah, that's correct. So they are encouraged to wear masks, but they're not mandated to wear masks. But now all students from grade 1 to 12 will be required to wear masks. And in our 2 larger school boards, that's already the case.
Okay, thank you for that.
Yeah, Councillor Lorentz, please go ahead.
Thank you, Madam Chair. Through you to Dr. Wong. This weekend we had assistance from the province on an enforcement. Wondering if you could just give us a brief update on how that went, and was it fruitful? Did it work? Did it do what we had hoped it would do? Or your thoughts would be appreciated.
Yeah, thank you for the question, Councillor Lorentz. So we're very happy that we received some additional enforcement support from the province this past weekend. They are going around to different areas in the province to do this. We have, like everywhere else, a lot of different workplaces and businesses, and as much kind of enforcement support that we can have, the better. The rate of compliance wasn't very high in Waterloo region. Not unlike when they have gone out to areas for the first time. So they did know, for example, in Toronto and Hamilton, where they had been previously, the rate wasn't high on the initial visits. They went up a little bit after the second visits. But even, in Hamilton on the second visit, it wasn't very very high either. Like ours, I think we were at 55% compliance. So I think also what's important to keep in mind is the province has also shifted in terms of their approach from more educational in nature to more enforcement in nature. So, their expectation is at this time, workplaces should be aware of the precautions that they need to put in place and ensure for their workers and patrons. And so they are going to expect more from workplaces now than they did before. And I think that is reflected in the number of fines and times when workplaces have not passed inspection. We are continuing to work with. Our enforcement partners have been doing this education and enforcement all along during COVID, and we will continue to work with the Ministry of Labor. We understand they want to come back in the future as well. We want to continue to work with them to, further ensure that compliance with the requirements that are in place for all businesses and workplaces are met more fully going forward and continue to be maintained.
Any further questions, Councillor Lorentz? Thank you. Thank you for asking that question. I think it's really important. I see no other questions, so I'm going to thank Dr. Wong and turn the floor over to Deputy Chief Shirley Hilton to give us the vaccine rollout update. Welcome.
Thank you, Chair Edmund, and good afternoon. Yesterday, we received confirmation that Waterloo will be receiving their allocation, or at least confirmation on allocation of the Pfizer vaccine for February 8th, 15th, and 22nd. I provide that very cautiously, as we know that every week I come up with another scenario in terms of vaccine and vaccine supply. So I do provide that cautiously, but it does offer some planning hope in terms of the teams in getting certainly the second doses of vaccines to our long-term care home and high-risk retirement homes. So our mobile clinical teams did begin today to start that process and are looking to be administering the second doses between February 3rd and February 12th. For the long-term care homes and high-risk retirement homes. Also planning and scheduling for all other second doses, sticking within the prescribed schedule of up to 42 days. Concurrent to that, the team is also looking at individuals who require alternative level of care. So ensuring that those that might be in the hospital now and then transferring to long-term care home and retirement homes are receiving their vaccine, so that we are ensuring that our long-term care homes and retirement homes are fully vaccinated for those that are eligible, and obviously those that are volunteering for the vaccine as well. To date, we are at approximately 16,000 doses administered, with close to, I'd say we're about not quite to 3,000 people who have received their second dose within that time frame as well. So we'll keep up to date in terms of where we are on those that have been fully vaccinated. In addition to that, the team is looking at how and when our Grand River Clinic has been paused, and how or when we can actually resume that clinic, so that we can continue with our phase 1 high-risk population. But again, I'm optimistically cautious in terms of our vaccine supply. However, last week we didn't know what our allocation was, so at least we have an idea for our planning for the month of February. That's all I have.
Thank you very much. Councillor Galloway, go ahead.
Well, thank you, Madam Chair. I'm not sure if this is for Deputy Hilton or for Dr. Wong in regards to the vaccine. So is the province of Ontario counting six or 5 shots per vial of the Pfizer vaccine when they are shipping, or do we have the necessary syringe to get the 6th shot out of a vial? I'm just wondering if we're dealing in five or 6. What number are we using, or what number is the province using when they're shipping to us? Because that's significant. Significantly more people could be vaccinated if you get the extra shot out of it.
So, Deputy Hilton, do you want to take this, or Dr. Wong?
Perhaps I can start, and then Dr. Wong can speak more probably broadly, maybe from the provincial or sort of federal aspect of it, but certainly locally. What we do know with our teams is that, yes, there are occasions when they've been able to get 6 doses out of a vial. This is not something that they can say is a consistent number that they get from the dial. What we've been told is, yes, the 1 milliliter syringe obviously makes it easier to extract the dose. There is, I understand, a need for the 1 milliliter syringes for obviously other areas of care. So they are using 3 milliliter syringes as well. But there's another number of factors that contribute to being successful in getting that 6th dose. And it is obviously the pharmacy tech who is extracting the vaccine itself. So their level of expertise, whether they're in perhaps different lighting conditions. So unfortunately, there's a lot of variables that doesn't make it a consistent practice of getting the 6th dose necessarily. So it's a very difficult one for us to say definitively we are getting 6 doses out of a vial. But Dr. Wong, you might be able to talk more globally.
Yeah, I don't have more information at a provincial or federal level, but I can say that I believe locally, when we have been sending up our updates to the province in terms of how many doses we need, we are not counting on always being able to extract 6 doses. And so I think, we are counting on at a minimum 5 doses and possibly 6, but I think that's, what we've been sending up to the province in terms of estimating what we would need to cover the priority populations that they want us to do. I don't really, I'm not aware of an impact at this time of, the news that's been out there about maybe Pfizer wanting us to anticipate always getting 6 doses. It's right now, it's not something we can guarantee. So I don't think we're relying on that.
Well, my understanding is that Pfizer is assuming 6. At this point in time. So whether you get 5 or 6, they think they've shipped you 6. And so I'm just wondering whether or not that means we will get fewer vials in the near term because of the worldwide shortage. And Pfizer is counting 6 when it comes out off the assembly line in Belgium. And the federal government thinks we're getting 6 and the province thinks we're getting 6, but we can only get 5. Does that mean we can vaccinate fewer people? I guess that's...
Oh, yeah, I don't think we would be different than anywhere else in the province. Based on the discussions the ministry has had with us and other health units and other hospitals, we're in the same boat as everyone else.
Okay, thank you.
Thank you. And I do really want to underscore what Deputy Hilton was saying, and that's the expertise of the pharmacy techs that are extracting the vaccine from the vials. It's really very impressive, and they're obviously very good at what they do. Councillor Lorentz.
Yeah, thank you, Madam Chair. Through you to Deputy Hilton. I appreciate the update, and I kind of understand your skepticism with the province when you start talking about maybe it's the 8th to the 15th to the 22nd. Mm-hmm. And I know last week or the last time we talked, we had the phase in that we were looking at a graph, a plan on how we were going to work in phase 1, phase 2, and phase 3. And I guess I have a couple of questions. The first one is, where exactly are we on that plan? Has it been delayed because of the lack of vaccines? And secondly, how are we gearing up to be able to go into phase 2 where we start inoculating the general public? I mean, are plans underway? Do we have all of that stuff moving forward in the upcoming months? Or are we just kind of working from phase 1 to phase 2 to phase 3? So I think a public update would really be helpful. Thank you.
Deputy Hilton.
Thank you for your question. In terms of where we are a bit behind in phase 1 because of some of the pause related to the vaccine supply. However, and again, this is it remains to be seen. So the province has told us that they will be making up for this in March. So where I have some optimistically cautious reports, it's around, we'll see what we get in March. What we do know is what we've been allocated for the 8th, the 15th, and the 22nd, which I believe is on par with what we should be receiving. So we'll see what happens in March as it relates to if we make up any ground. That said, definitely there's an incredible team working every day in terms of the mass immunization plan. So the mass immunization plan, as you look at it from phase 1, 2, 3, what I always remind people of, it's not a hard stop or hard start between phases.
Right.
So it's certainly a fluid, phased in approach, but also what's been most recently described as a layered approach to vaccination. So, adopting we already know related to the mass flu immunization, so adopting some of those practices, but looking at what are modes of delivering the vaccine. So yes, we have some fixed sites, and that'll be coming out shortly in a few weeks as to identify where those additional sites are outside of Grand River Hospital, but then also looking at our mobile clinical teams and their availability to move into other areas of need for vaccination. But we're also relying upon our community health, our primary care, in addition to our pharmacy. So it's a very layered approach as it relates to moving into our phase 2, where we start to see some more of the mass delivery of the vaccine. But more importantly, when we look at the planning, understanding that the province and through General Hillier, we've been given a number to plan toward, and that's a 10,000 per day vaccination plan. So the team is really looking at how can we on a regional basis achieve that with the appropriate staffing, the appropriate locations, bringing vaccine also to some of our more of our marginalized members of the community. So how can we make sure we have that full wrapped around approach? We certainly are looking at our other hospitals. With Cambridge Memorial, is there opportunity there in addition to St. Mary's? So it's a full wraparound planning strategy that's occurring behind the scenes. We already know what we're able to do with our current supply and how we're able to continue with that, but the planning at the back end is really on the mass immunization plan to stay with that particular placemat that you have highlighted there.
Councillor,
Just to follow up, Madam Chair, if I could.
Yep.
Yeah, that's really good information, but I just want to clarify. So you're saying at some point in the not too distant future, we'll be ramped up to do 10,000 vaccinations a day in the region?
That is, we're for that. I'm not saying we'll have the vaccine for that, but we are planning.
No, I understand that.
That is truly what the team is planning for. That is something that the province has put in. So, in terms of the planning, that is exactly what we're trying to achieve, so that we stay on target for completing the vaccination as efficiently and as quickly as possible.
Dr. Wong, did you want to add something?
Yeah, just that we anticipate that the ramp up is not going to be like a linear ramp up, but more, right now we have very limited supply. We've had recent shortages. So it's kind of more like a ramp up that grows more exponentially further down the timeline, more towards the spring, when we'll have a lot more doses. We anticipate at least we'll have a lot more doses, and then the ramp up will be much more significant then. So it's not a linear process, and people think we're slow, or we don't have a lot of vaccine, which means we won't meet our target of trying to have most people offered the vaccine in early fall. If the production of vaccine ramps up as anticipated, then we'll be able to catch up later. But in the meantime, what we are planning for, as Deputy Hilton said, is planning for the ability to be able to ramp up as much as the supply that will be given to ramp up to be able to accommodate a much greater amount of supply that we hope will be coming to us. So we're definitely doing a lot of work behind the scenes to be ready for that.
Councillor Lorentz, any further questions?
Yeah, just so we're clear, so in phase 2, we talk about doing beginning in April. So if we have the vaccine, say an unlimited quantity or as much as we want, we will be starting to inoculate at 10,000 a day in April.
The team, if I may, the teams are actually preparing for that. So when they start to look at their mandates in terms of looking at our sites, looking at who else can participate in the vaccination of the population, that's where we bring in our primary care doctors. That's where we bring in pharmacies. So when we start to look and to go back to, what I said, the easiest thing would be to have one mass site. That would be easiest for planning, but it doesn't make sense in the context of how to get as many people as we possibly can. So that's where we have to rely upon our community health partners and our primary health doctors, so that they can assist in that, so that we can, as Dr. Wong had said, ramp up to accommodate as many vaccines as we have. That's the goal in terms of ensuring that we are ready. So as much as it looks like it in the current state, all we have is one clinic and one, mobile teams. That truly, we will be ready once we start to see a more stabilized vaccine supply.
Well, thank you very much. That's very encouraging information, and it seems to me that we have the right person driving the bus here. So thank you so much.
Very nice. Dr. Wong, did you want to add any comments? Okay. Councillor Clarke, I've seen your hand go up and down. Is it up or down? It's down. Okay. Councillor McGarry, go ahead.
Thanks. I guess some of my questions were already answered from some of the questions Councillor Lorentz asked, but a more specific question is really just about the numbers to vaccinate. I know that the call went out from one of our partners, Dr. Ball, about people that could come and help vaccinate. But if we were to go to 10,000 a day, do we have the staff so far sort of identified if we had the vaccinations to actually accomplish 10,000 a day in the region?
Deputy Hilton?
Yeah, thank you. Currently, we do have a team working on the staffing piece of it as it relates to not only vaccinators, but okay, what does a clinic look like? How many hours are we looking at for vaccination? How many vaccines can one vaccinator do in a day? And again, we talk about variables. Are they getting their own syringes ready, or do we have a team that's doing that for them? We have things that are like the pre-registration already done. So the team is looking at a number of variables as it relates to how many do we need in a particular site, how many do we need in a particular mobile setting, that sort of thing. So yes, the call has gone out, and it's interesting because we've certainly even seen not only just from primary care physicians and nurses, certainly, pharmacy school nursing as well, but we're seeing other areas such as optometry and wishing to assist in, vaccination as well. So definitely we have a team who are recruiting, and will we have enough for 10,000? I'm saying that is our goal. So yes, I'm hoping, yes, we do, in terms of all of the settings that I've just spoken about.
Dr. Wong, did you want to add something?
Just really quickly, that there's also a lot of work behind the scenes on different scenario planning, because we don't know what additional vaccines we'll get. And, we don't really know the specifics yet of their characteristics. So for example, we do know that Pfizer, which is the only vaccine we've had to date, requires very specific and even complex storage and handling. And so it's not a vaccine you can distribute the way, easily like you can the flu vaccine, for example. And so that will, so we don't know, but again, we can't wait until we have confirmation because we have to plan in advance. So it's another element that adds to the work in terms of contingency planning to try to meet our goal of 10,000 a day. Just wanted to add that.
Councillor McGarry, any further questions?
If I may, Madam Chair, for a follow-up, and it's really about the human health resources. And I can certainly say and vouch for the fact that this is a team led by, the rock stars that we have right here on our call, that we do have those contingency plans. So around the human health resources, it would be helpful at some point if you could identify the types of disciplines or the type of multidisciplinary team that could assist. It may not be just a registered nurse that's needed for an injection, for instance, but who's there to sort of help follow up that 20-minute waiting period that you need to make sure of after a vaccination's been given. But it would be really helpful at some point if we could sort of have some ideas of the types of individuals that could assist in this way, even with logistics. I could certainly put it out to some of my networks if they're still looking for who could sort of assist in this kind of way, is really what I'm saying. But thank you for all the work you're doing. It's an incredible rollout of detailed logistics that you're trying to do, and I'm hoping that we can help.
Thank you. I don't know, Dr. Wong, Deputy Hilton either. It's a great offer. The detail to which this planning has gone already is really quite impressive. From IT to security, I mean, all of those aspects are being considered. So I thank you for that. I don't see any further questions. Colleagues, I guess I just wanted to share with you that right before we came on this Board of Health call, I got a phone call from a colleague of mine who's a chair in another district, just phoning to say thank you very much for, and actually I think Councillor McGarry, you spoke with this person too, but talking about how we had gone forward with our task force and rollout, and they really modeled their approach to the vaccine rollout in their area after us. So not only is good work happening here, but we're also sharing that and providing a good example to other people. So Deputy Hilton and Dr. Wong, thank you very much. And as Councillor McGarry has said, I recognize you're sort of the tip of the iceberg and there's a whole army of people behind you, but thank you for this great work. That's a great update. Councillor Harris is going to present a motion that most of you have already seen distributed, and very timely given the announcement that Minister Lecce and Premier Ford has just made. He is moving it, and it's going to be seconded by Councillor Lorentz. So I would turn the floor over to you, Councillor Harris.
Thank you, Chair Robin. Would you like me to give some explanation of the motion and then read the motion, or do I introduce the motion and then?
You can do the explanation and then.
All right. Okay. Well, thank you, colleagues. Look, with this afternoon's announcement that more school boards, our local Waterloo Region school boards, will return to class education next week, and as the province looks to reopen after the state of emergency and stay-home order, likely to return to a color code framework like we saw before, we are and have heard from more businesses and constituents looking for a more equitable capacity limits and fairness for small businesses, including many of the local restaurants here in our region who have spent considerable money investing on ensuring their facility keeps not only their own staff, but patrons safe. Although the vast majority of businesses here in the region have demonstrated that they take compliance seriously, obviously we know we can do better. Using a reduction in numbers to 10 rather than a percentage makes sense for businesses such as restaurants and gyms when we in fact have more spread and are trying to restrict the mobility. However, though, as restrictions lift and are ready to allow more mobility, advocating to replace restrictions that are more equitable based on size has merit. In fact, we've heard many local establishments that have typically, say, a fire rating of 400 are held to the same standard as a business that would may only be able to accommodate, 30 and capped at 10. Under the color code framework, these provisions need to apply in order that all businesses have clarity in the rules for reopening. Advocating for more equity to allow small businesses to be open when other stores like Costco and Walmart are allowed to sell non-essential goods also has merit. I'd like to thank, of course, Dr. Wong and regional staff and the legal and enforcement branch for weighing in with your advice and recommendations in the crafting of this motion. And so I'll read the motion now. That the Regional Municipality of Waterloo requests that the Province of Ontario review and potentially amend the Reopening Ontario Act and associated regulations in order to ensure a timely enforcement response that is built on the consistent application of the law and reduces frustration among businesses and enforcement agencies in the following areas. A, capacity limits that are equitable across businesses, including big box versus small retail businesses and restaurants. B, clarify regulations provide for a consistent application of the regulations across the province. And C, enhance the provincial inquiry process in order to assist public health units and enforcement agencies with a timely and consistent interpretation of the law across the province. And further, that a copy of this resolution and associated material be circulated to all municipalities in the region of Waterloo and local area MPPs. I will also thank the seconder, Councillor Lorentz. I know he will likely want to chime in as well, as I know he has heard from local businesses about perhaps this inequity. I know, and I read in the news recently too, that some of these smaller businesses, and that goes to point B, just with that clarity and C about that inquiry process to allow small business to and really ensure what the laws are so that they are compliant, because we know local businesses in this area want to be compliant, want to adhere to the regulations, but most importantly, keep their staff and patrons safe. And so with this, we hope the province will entertain, a more equitable approach as we gradually reopen. So thank you, Chair. With that, I'll leave it at that.
Thank you very much. Councillor Lorentz, would you like to make some comments, being the seconder of this motion?
Well, I wasn't going to, but I'd be happy to. Thank you very much. And I want to thank Councillor Harris for bringing this forward, because I think it really is important. And what it really boils down to is fairness and equity in the business community. There's so many small businesses out there that are really suffering from this. I mean, I had a retail business for over 10 years. I still have a small business, and some are affected more so than others. I mean, I heard a story about a barber in Guelph who it's a one-man shop, and he's been closed since the last shutdown. And so they really need to be able to look at how these businesses run and have some fairness in the whole system. So I support this wholeheartedly, and I think the business community would look forward to seeing this happen as well. So thanks again, Michael.
And thank you, Councillor Lorentz. Councillor Shantz.
Thank you. I support the motion. I too have heard from a lot of small businesses that see the inequity, but I have a question, and it's more a process. Is this coming from the Board of Health or from Regional Council?
This is the Board of Health.
Okay, so I mean, my question is more, is it a motion for the Board of Health or is it a motion for Council? Like, does it make sense to be doing it as Board of Health?
Mrs. Fletcher, would you like to comment?
Under the Municipal Act, the Board is Regional Council. So technically, when a decision is made at the Board of Health, it is a decision by Regional Council at the same time. And that's why you will see on the agenda that we are also passing a confirming bylaw at the end of each and every meeting, because we're confirming any action that does occur at these particular sessions as well as at regular Regional Council meetings.
Okay, thank you.
Does that clarify? I thought I saw another hand. Thank you, Mrs. Fletcher, for that clarification. I'm wondering, with that clarification, would it be deemed a friendly amendment if we were to distribute it to colleagues? And I'm thinking of other regions and other municipalities, maybe through AMO and FCM. Councillor Harris and Councillor Lorentz, is that a friendly amendment? Okay,
Very, very friendly.
thank you. Okay, seeing no other speakers, I would ask you to use your voting buttons and vote to support or vote against this motion.
That is carried.
Thank you very much. And again, thank you for the leadership, colleagues, Councillor Harris and Lorentz. That's great. I'll now entertain a motion to enact the bylaws first, second, and third readings. This is moved. Councillor Armstrong, did you have a comment before we move on? Okay, thank you. This is moved by Councillor Galloway and seconded by Councillor Jaworski. Bylaw to confirm the proceedings of the Board of Health Regional Council of the Regional Municipality of Waterloo at this regular meeting held on February the 3rd, 2021. I would ask you to use your icons to support or vote against that.
That is carried.
Thank you, colleagues. That is carried, I believe, unanimously. I would now entertain a motion to go into closed session for a closed special council session. The motion is moved by Councillor Jowett, seconded by Councillor Kiefer, that a closed meeting of special council be held on Wednesday, February the 3rd, following the Board of Health meeting electronically in accordance with Section 239 of the Municipal 2001 for the purpose of considering a labor relations matter. So I'd ask you to use your icons to vote for or against.
That is carried.
Okay, colleagues, so we're staying on this same connection, Chris, but everybody is leaving except I think Mr. Lochner and council members, and we obviously will stop live streaming.
Correct. Just give us a few minutes to make sure that everybody's out of the room and that we've got the webcast turned off. So Leanne, if you can just check in, and I'll be leaving now.
Okay, we will not resume until that's confirmed, colleagues. So why don't we take a 5-minute bio break?
Leanne, Madam Chair.
Yes.
Isn't there another